On-the-scene coverage of ACC.14 is supported by Janssen Pharmaceuticals, Incorporated.
I'm Dr. Alfred Beauvais. I'm here at the annual scientific sessions, American College of Cardiology. With me today is Dr. Harvey White from Auckland, New Zealand. Dr. White has presented a very interesting study on a new anti-inflammatory agent that has some potential for the treatment of patients with chronic stable coronary disease. So Harvey, welcome to our program, and explain a little bit about what this new compound is and what you expected, and then some information about your trial.
Okay, so it's a pleasure to be able to talk about the stability trial. So we looked at a new inflammatory pathway, blocking LPPLA2. LPPLA2 is the enzyme that converts oxidized LDL in the plaque to other inflammatory compounds that cause necrotic core expansion and may lead to a ruptured plaque. So we have a drug, dirapitin, that reduces it by about 60%. So we wanted to test what's happening in the plaque. We had a primary endpoint, cardiovascular death, MI and stroke, 15,828 patients, 39 countries. We failed to show a significance on the primary endpoint of cardiovascular death, MI and stroke. It was reduced 6%, but not significant. One of our underpinning things that we did in the trial, which I think is very important for future trials, we wanted to test whether dirapitin on the back of standard of care, guideline recommended therapies would improve patient outcome. At the end of the trial, 3.7 years, 96% of patients were taking statins. 93% were taking aspirin, beta blockers, ACE inhibitors, 78%. So a really high standard of care. Failed to meet the primary endpoint, but our first pre-specified endpoint, looking at coronary events, was nominally significant. So there was a reduction in coronary heart disease death, myocardial infarction, and urgent revascularization. P equals 0.045. So we think that's a signal of possible efficacy. Of course, the primary result was not positive, and we have to be cautious in the interpretation, but we think there's enough information here, and we'll be looking at biomarkers and genetics and subgroups to move forward. There's another trial, and we'll be looking very carefully at some of the data we already have.
Good. So I think if we intuitively think about this, it would be pretty logical to think if we could stabilize the plaque, we would reduce the incidence of acute events in somebody with stable coronary disease. I think your data is interesting because even though it didn't show a composite endpoint result, it does provide a signal that suggests that we ought to be looking more. It sounds like you're going to follow up on that.
Yeah, hopefully, and you know, surprisingly, we found no effect on stroke. But we know stroke's not just caused by carotid plaque, atrial fibrillation, etc. So to focus on the coronary events, I think, is very important, and we can look very closely at the LPPLA2 levels, which we don't have to report at the moment. We can look at the correlation with LDL. We found in subgroups in smokers who have high levels of LPPLA2 that was a higher effect. So I think there's some very interesting stuff here. It's a first step, obviously, and we'll need to look at other information. The sister trial, the SOLID trial in acute coronary syndromes will read out later this year. I think it's an exciting time. The first trial looking at inflammation.
Good. Well, thanks for being here. I think we'll be looking forward to the downstream studies that you're going to do with this new compound. Thank you.
Thank you.